Hello, Dr. James Bogash, expert in health and longevity, and today we're going to talk more about the microbiome and anti-inflammatories, two of my favorite topics, both the microbiome and how massively important it is to keep a healthy one, but also anti-inflammatories and how they wreak havoc on our systems, and most people are not aware of it. The idea of popping an over-the-counter analgesic doesn't even create a blink in anybody's space. Personally, I haven't taken anything like that in probably 30 or more years. I've mentioned that before. Despite multiple martial arts injuries, I actually just broke my toe on Thursday. Wouldn't even consider taking anything for pain for that. But interestingly enough, we've seen in certain scenarios where anti-inflammatories can actually drive inflammation. In some cases, really horrendous inflammation. And it has been established that anti-inflammatories can aggravate certain inflammatory bowel disease, think Crohn's disease and ulcerative colitis. This is pretty well accepted. And yet we think it's an inflammatory condition, so we should be taking anti-inflammatories. But it is well accepted that they can actually drive and make conditions worse. Even if somebody isn't in the middle of a flare-up, if they're in a quiescent period, they can have a flare-up from taking anti-inflammatories. So this particular study was an animal study, and they looked at, in particular, a certain type of E. coli, the adherent invasive E. coli, which is a particularly nasty version of E. coli. And it's found in, depending upon the study, anywhere from 21 to 62% of people with Crohn's disease. Healthy populations, 0 to 19%. So really a major player in a lot of people's inflammatory bowel disease. And they found that giving NSAIDs, think ibuprofen, in this case drove inflammation, especially through the NLRP3 inflammasome. I've talked about this before as it relates to COVID and inflammation in the lungs and how things like melatonin can actually help control inflammasome production. But just let it be known that anti-inflammatories are not good for the gut, period. And in some cases, they're actually devastating for the gut. Yet another reason to not rely on these as a method of controlling inflammation. I'm not a fan of them for musculoskeletal conditions. Forget what they do to the gut. They actually have a tendency to destroy joints, destroy the liver, destroy the kidneys, everything. So before you pop that next anti-inflammatory that's over the counter, maybe it's time to really consider what it's doing to your body. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.